Equities on Finance. We're here at the Innova booth with Cheryl, and we're going to be talking about the Rabin. And she's going to be running the test on Chris. We love this test. We have it in our office. We use it every day for glaucoma and AMD. And so let's go ahead and take us through the process.
Okay, so Chris has the Rabin cone contrast test up right here. He's going to use the hand controller to respond. He's going to look for the opening of the Landau C, and he's just going to use the corresponding up, down, left, and right from the controller. So Chris, I'm just going to get started. We're going to just do one eye here. But you can see we're going to threshold. We're reducing the contrast for each cone type. We're measuring them independently, so it's very different than a color confusion test like an Ishihara or a D15, which is more of an arrangement. We're actually measuring the individual cone function. With that, we can produce a score. You can use that for progression over time.
Okay. And then Cheryl, can you show me a copy of the score and stuff as well too? The sheet?
Yes, absolutely. So there's many ICD-10 codes with the product, and you can see that anything from macular degeneration, glaucoma suspects, diabetic retinopathy, even cataracts are billable. Also, we can manage high-risk meds like Plaquenil. There are ways that we teach you how to use it for the diabetic eye exam with the visual disturbance and the impaired visual function codes. So there's many ways that you can reimburse, and the average reimbursement for 2024 Medicare is $55. So it's a great reimbursement. A lot of doctors are just really adding a lot of clinical value as well as financial value. And I know that, Chris, you have it in your office, so if you want to talk about how you use it, that would be great.
Sure, yeah. Really quick test. Evaluates retinal function. So probably the three biggest conditions we use it for are diabetes, diabetic retinopathy, macular degeneration, and more for glaucoma as well. It gives great clinical value so we can provide better care to our patients.
Perfect. Thank you so much, Cheryl.
You're very welcome.